here with Dr. Carol Penn and Dr. Dietrich Gorman, and we're here to talk about prevention of the coronavirus today. I'm sure you guys
Yes.
have heard enough about the number of cases and the deaths and things like that. And we want to talk about what we can do and what the government has been doing to help slow the spread of this disease. And first, I must make a disclaimer. We are not infectious disease physicians, nor do we claim to be COVID-19 experts. We're not epidemiologists. We are all, however, physicians on the front line in the fight against COVID-19, and we've been following the developments in the response. Okay, so first,
Excellent.
thanks, Dr. Dietrich. So first, I just wanted to talk about testing. Everybody wants to know about testing. We've been clamoring for testing. And testing has ramped up in cities across the US like Delaware, New York, Massachusetts, and here in Texas. And a hospital in Virginia actually provided a step-by-step example of what we might encounter if we go to one of the testing stations. And I'll also mention too that some companies are doing in-home testing as well. So this hospital in Virginia said, provide an example, and it says first you make an appointment with your doctor. The doctor determines the need because you can't get tested without a doctor's order. Then the patient calls a scheduling line for an appointment for the drive-through testing. So you're where based on where you are, see if there's a scheduling line first. Don't just drive over there, and because you might wait in line for a long time and then get turned away because you don't have an appointment. And it's only for patients who have symptoms like fever, chills, cough, shortness of breath, things like that. And if you are symptom free, don't be surprised if they turn you away. So the worried well cannot get tested. We know that the incubation period can be up to 3 weeks, but if you have no, 2 weeks, sorry, from 2 days to 14 days. But if you have no symptoms, expect to get turned away. Okay, so when you get there, you may be asked for your ID and insurance card if you have one, if you have one. Okay, but they might take a picture of you. They're going to make a label for the sample, and the lab tech will ask you to roll down your window a crack and tilt back your head. And then they'll swab your throat. Now, I've heard two things that they do nasal and oropharyngeal, nasal meaning through the nose, oropharyngeal meaning through the mouth swabs. So I've heard two types. One is mouth and nose, and then the other one is just the throat.
Okay.
So then you roll up your window and you leave. You expect to get results back in as late as 5 to 7 business days. Some people, especially the positive cases that we're hearing about, they get results back like in a day or two. Now I know that where I work, we actually were able to procure a test through the state. It was a long process, and we got results back. It took a few hours. The person was there for a few hours, but we got results back the next day and they were negative. So, it may vary based on state or facility. Now, there is still a lack of testing available, thus, the need for social distancing and quarantine, which are crucial to prevent the spread of disease. Okay, so first, and you guys might know this, we've been hearing it throughout the week. Social distancing is a term applied to actions taken to stop or slow down the spread of a highly contagious disease, mainly by decreasing the amount of human contact. And we've seen that in the form of canceling events like festivals and sporting events and restricting the number of people in groups from like 50 down to 10. Colleges converting to online courses, restaurants only allowing carry-out or curbside service, and any establishment only allowing 3 customers at a time. The beach closures in Florida, the Florida Keys, Panama City Beach, and others. And all these are government sanctioned methods of social distancing. So on an individual level, and you may be doing some of these already, It includes greeting each other with a wave or a nod instead of hugging. Some people are bumping elbows. And
Yeah.
in the World Health Organization, and then in other countries, the World Health Organization says you might do a bow. I think that's
Oh,
very graceful. But
maybe a
the
salute.
or you can just salute, or the nod like we do. You know. So, and as the World Health Organization advises, you keep at least 3 feet between yourself and anyone who's coughing or sneezing. Now, I have heard 6 feet. I've heard that droplets can travel up to 6 feet, and this is so that you don't inhale the respiratory droplets. Okay, and then staying at home if you feel unwell. And if you do develop symptoms, if you start to feel in any way worse, we do want you to seek medical care quickly. But when you do so, if you can, try to call your primary doctor ahead of time, or maybe the ER, just to let them know that you're coming. Give them your travel history and exposure history. Or if you're calling 911 for an ambulance, let the dispatcher know also of your symptoms, travel history, and exposure, so that these folks can prepare, because they may need to take you to a special area to prevent spread to patients who do not have any respiratory issues. So finally is quarantine. So there's isolation and then there's quarantine. So isolation is the separation of sick people from those who are sick. And I'm hearing more talk of COVID-19 being airborne. We primarily heard at my job that it was respiratory droplets, but you isolate people, to keep them from spreading the disease to other people. And then we on the job, we wear our masks. I'm seeing large like headgear over face masks as well. I've seen as much as complete, body coverage as well when someone is in isolation. And then there is quarantine, which is the separation and restriction of movement of people who have been exposed to a contagious disease to see if they get sick. Okay, so and more than a quarter of Americans have been ordered to stay home as much as possible. The governors of New York, Connecticut, Illinois, Pennsylvania, California, they've shut down most businesses, essential workers, and like those who work at grocery stores, pharmacies, takeout restaurants, in addition to the obvious, like police stations and hospitals, they're still expected to work. And there have been seniors hours at various establishments like Walmart, Target, Safeway, Whole Foods,
Dollar
and
General.
Dollar General, right? And here in Houston, Luby's, which is like a little restaurant where you can take out. And usually it's soon after opening, so that the elderly can shop calmly without so much concern for panic shoppers. And so, and here in Texas, there's been the statewide shutdown of schools and gyms, bars, and eat-in restaurants. And I've also seen that malls have closed. So so the Houston Galleria has been closed for
Mhm.
at least a week. And gatherings of groups of more than 10 are not allowed, but domestic travel is still allowed. Dr. Anthony Fauci, the companies, yeah, it feels like a company. The country's top infectious disease doctor says that it's very difficult to predict when this will end. And social distancing will only work if every segment of the population is involved, including the young people. The head of the WHO, the World Health Organization, says, "Today, I have a message for you young people. You are not invincible. This coronavirus could put you in the hospital for weeks or even kill you." And the young folks have unprecedented levels of diabetes, hypertension, obesity, HIV, respiratory diseases, and autoimmune diseases. So they're not invincible either. So all of us of all ages, we need to, participate in this. So, so that, and so, yeah, that's the segment on social distancing and quarantine, isolation, things like that. Dr. Dietrich is going to go over one of the very important things that we hear about all the time. She's going to show you how to do this very important thing, and that is hand washing. Take it away, Dr. Dietrich.
Thank you very much, Dr. Kadisha, and hello, Dr. Carol. Before I get started, though, I just wanted to say hi to a couple of people that have been kind enough to share their Friday evening with us. I see Yvonne, who's here, DeJarvis, Kasali, and then there's also a person, Veronica, who asked a question. Keep in mind, yes, I am practicing in Pecos, but our other two members of this Perspectives in Primary Care are in different parts. One is in Houston, and actually one is in New Jersey. So, we can't really comment as to how many tests we have, but some places don't have many testing kits and some do. And so it's going to be up to your doctor, nurse practitioner, PA to decide if you meet the criteria to even be tested. And one of the questions she asked is, do you have to be on a ventilator to be tested? And that's definitely, Dr. Kadisha, you can answer that, but no, you don't. But go ahead.
I know it feels like people who are in dire straits are being denied testing, and that's not true. It's just that there's a limited supply. You do not have to be on life support to get tested. It's certain symptoms like fever, chills, cough, shortness of breath, a travel history, or exposure to a laboratory confirmed test positive person who's tested positive for COVID-19. You do not have to be on a ventilator before you get tested.
Okay, thank you so much. And so thank you for talking about prevention and social distancing. I'm going to talk about the ever important hand washing. And yes, I said hand washing. I mean, it's not only just to have clean hands, but we want to help decrease the spread of infection, right? And so you may be thinking to yourself, Dr. Dietrich, how are you going to be talking about washing your hands? I've been taught how to wash my hands ever since I was a kid. Fair enough, that's fine. But I actually want to talk about the importance of hand washing in the proper research way to do the hand washing, okay? And again, this information is from the CDC. So I got my information from the CDC. So, you can go to their website and you can see what I'm talking about, that this is coming from the CDC. Okay, so keeping your hands clean is one of the most important things that you can do to help decrease the sickness and the spread of germs and disease, right, to others. You don't want to, of course, not give it to yourself, but you don't want to spread it to other people as well. And many diseases and conditions are spread by not washing your hands with soap and clean running water, right? The CDC actually does have a specific way to avoid getting sick and spreading germs to others. And the guidance for effective hand washing and the use of hand sanitizer was actually based on data from a number of studies. So that's interesting. And again, this information is from the CDC. Okay, but listen to this first, okay? So despite widespread knowledge of the importance of hand washing, there's still room for improvement, all right? A recent study by the American Journal of Public Health showed that 31% of men and 65% of women wash their hands after using a public restroom. Okay? All right? Okay, come on, y'all. All right, we can do better than that. Okay? So just think about that. We've all seen people like that, and I'm not, trying to bust you out if you're one of those people, but there's a lot of different people that come in and out the restroom now, so please just think about it, okay?
Seen it.
So,
yes. Check, seen it.
Right. So hand washing with soap and water definitely helps remove germs from the hands. It helps prevent infection, okay? Because you might even not even know it or realize it, but people are rubbing their eyes, putting their nose, picking their teeth. They ate a meal, hands in the mouth, those mucous membranes that are just waiting for, of course, they're a protective barrier, but those germs that are there just waiting to get in there. You see what I mean? And those things, we don't even realize that we're doing it. It's subconscious, okay? But we really need to be mindful about that, because these are definitely entry point for germs, okay? And Also, germs can be spread from just preparing your food. If your hands aren't clean before you start preparing food, those microbes can get in the food or your drinks or whatnot, and then, get into you that way. Okay. And so germs are being transferred by inanimate objects, toys, so many different things. Okay. And probably, by the way, I'm going to be doing a live stream about specifically that, things you wouldn't think about that are containing germs on them. They can definitely cause problems. So, stay tuned to that. But teaching people about hand washing really helps decrease the spread of disease and infection. Okay, so how are we supposed to wash our hands? Can I show y'all?
Please.
Okay,
Yeah.
can I? Okay,
Please.
so give me just 2 seconds. I happen to be doing this live stream by my sink, my kitchen sink. Okay.
Oh, I see your sink.
You'll see the knife. Okay. Okay, so you want to actually wet your hands with clean running water. Actually, warm or cold is okay. Okay. So they're recommending you don't want to like fill up a sink full of water, because you don't want to just dunk your hands, because you can actually recontaminate yourself with just standing water. Imagine you wash all the germs off and then you rinse your hands back in it, so that's just kind of recontaminating it. Okay. But it's actually recommended to, wet your hands. And actually, some of this stuff I was actually surprised with. I'm actually surprised. So some of the things are recommended, but they're actually wanting you to wet your hands pretty good, then turn off the water, because they're saying it's a lower chance that you can re-inoculate in this phase. And then you want to kind of lather your hands by rubbing them together with the soap. So I'm using a bar of soap, and why not add some aromatherapy in there? Get a nice fresh bar of soap. It smells so good, so refreshing. Okay. But you want to just lather your hands. Lathering your hands actually creates friction, which helps lift the dirt and the grease and the microbes and stuff from your skin. And like I said, microbes are all over the surfaces and whatnot, okay? And they're actually particularly under high concentration when they're under your fingernails. So some people actually have a little bit of a bitty brush or a cute little thing to get underneath your nails, okay? So for how long are we supposed to be doing this, right? So I don't know if you've heard of like 20 seconds, at least 20 seconds. Okay. And so for me, I know they said to turn off the water because you want to kind of help conserve water or whatnot. But for me, the soap is getting sticky. So I'm going a little bit away from the guidelines, because I like to have like a nice running thing to get that lather really good. But they're recommending washing your hands about 15 to 30 seconds, which actually removes most germs from your hands, then washing for shorter periods of time. And so they're actually recommending singing the happy birthday song. Y'all heard that? So singing it twice, okay? But for me, being a doctor and singing happy birthday 50 times a day, because you do it before you see a patient and then after a patient, that can be a little challenging, because that song's going to be stuck in your head forever. You see what I mean? 50 times a day. So we might need to, us doctors and whatnot, might need to come up with another 20 to 30-second song to get things going, right? Okay. So also, it doesn't have, like I said, it doesn't have to be really hot, because that could possibly dry your hands out. Of course, it doesn't have to be ice cold, but you do want it to be running water, okay? So for me, like I said, I don't want to scald my hands.
Oh, I see Steve.
Yeah, I don't want it that hot. Okay, so it's not too bad. Okay, so rinse your hands under clean running water. I like to do it where the water is dripping down, okay?
Yeah.
Okay, when we're going to surgery, we do it like this so the water can drain, but like for our practical purposes, we'll do that. But make sure you get some of that wrist in there and just kind of rinse it off, right? Okay, then you're supposed to dry your hands with a clean towel, okay? So I don't know if you can see my paper towel over here. I never, like, especially like in a public place, they have the things where you can just pull down, or you can put your hands in the dryer, okay? So I'm just gonna get it from here. Just dry. So I personally wouldn't use the towels. Okay, I wouldn't use the towels that everybody's using. Use a fresh, clean towel every time. Okay. Okay. So you see what I just did? I used the paper towel, and while some places actually recommend using the paper towel to turn off the faucet, um, they said this practice leads to increased water and paper towel usage. And they said that there's actually no studies that show that it actually improves the health. Okay, so it looks like we may have lost Dr. Khadijah again, but we'll keep going on. Okay, and I'll chime her back in. Okay, so like I said, I like to use a paper towel every time, and I even go the further extra mile to open the handle to go out the restroom with the paper towel as well, okay? Now, just a really quick blurb about hand sanitizers, okay? Can you hear me okay? Okay. So this information is also taken from the CDC, okay? A lot of people, you know, in this whole frenzy about Corona are running out to buy hand sanitizer. For me, I was running out and getting hand soap, you know, because for me, hand soap is better, soap and water, okay? But first, understand that the CDC actually recommends first using soap and water, okay, whenever possible, okay? And this helps reduce all kinds of infection, decrease infection spread of all kinds of microbes, okay? But if soap and water are not available, using a hand sanitizer with at least 60% alcohol will help you avoid getting sick and spreading germs to others, okay? And so for guidance for hand washing and use of sanitizer, it was actually based on some studies as well, okay? So the alcohol-based sanitizers can quickly reduce the number of microbes on the hands in some situations, but not all germs. They don't eliminate all the germs, okay? Or if your hands are really greasy or really dirty, hand sanitizers might not be as effective as just plain old soap and water. So first and foremost, try and go to the soap and water. Okay, and so when you're using a hand sanitizer, some people don't use enough, or they actually dry their hands before the hand sanitizer has dried, which isn't the best either. Okay, so it needs to be completely dry and at least 60% alcohol based. Okay. Okay. And needless to say, hands are very important to keep clean, okay, clean as possible, just to reduce the spread of infection. And hands are, of course, covered with skin, right? Skins are a very important barrier, okay, very, very important barrier to help us prevent infection, not only our hands, but our body, okay? But we also need intact skin, and we need a well-working immune system to help fight corona or any other microbes that can be out there that we touch or are already on our body, okay? And if they should break our natural barrier, like our skin or regular skin or our mucous membranes, that's when infection and disease can come in, okay? So let's head on over to Dr. Carol, because she's going to be talking about how important it is to have a strong immune system. And one of those components is getting enough sleep, right? When you're sleeping, you can build that immunity, okay? So Dr. Carol is going to take it away. And while she's doing it, I'm going to see if Dr. Khadijah can chime back in. Hey, Dr. Carol.
Hey,
Tell us
thank
about
you,
you.
Dr. Dietrich. Yes, and thank you for that. It is so important. We
Yes,
need to start a national campaign simply called Wash Your Hands. So that
yes,
again, and that's from the youngest child. If everybody would do their part, and your part could be as simple yet as profound as washing your hands and practicing good hygiene. People have no idea how that changed the course of modern medicine
absolutely.
when the doctors discovered about washing hands and not going from patient to patient without proper hand washing, without sanitizing before they went into surgery.
Exactly. You see those shows that are back in the day where they just, you know, they just started cutting and doing surgery just barehanded, and it's just like, oh, it just makes me just get nauseous when I see that.
And so many people died, of course, from
Yes,
infections that were
yes.
passed that way. Well, anyway, I'm yours truly, Dr. Carol, doubly board certified family medicine and obesity medicine, and I am a master movement meditation and mindset coach.
Yes, you
And
are.
I really, really specialize in teaching people how to boost their immune system through time-honored wisdom traditions. And I'm going to talk to you tonight about one of my favorite subjects, and that's sleep and a bedtime routine. Now, when you look at the science of sleep, we still don't have definitive answers as to why we really sleep and why we're neurologically designed to do so. But we do know that when we sleep, the immune system is boosted. That's when the body goes into repair mode. That's when we go into reboot mode. So we know that it is extremely important. And during this time, when there's generally more stress, our immune system is going to be challenged anyway. So we want, particularly if we're working from home, sheltering in place, in quarantine, this is a great time to take advantage of getting more sleep, getting more rest, and rebooting your sleep routine. So I'm going to start with a bedtime routine that's going to piggyback off of the wonderful hand washing that Dr. Dietrich just taught us. So one of the things when you're getting ready for bed, it actually is going to start at your dinner time. And I want your dinner time to be at least 2 or 3 hours before you go to bed. And everyone in your household, including you, is going to have a set bedtime. So let's say that bedtime for a case study example is going to be 10 p.m.
Mhm.
And you are going to finish your dinner time meal no later than 7 to 8 p.m. because you don't want to go to bed on a full stomach. Why don't you want to go to bed on a full stomach? Because if you go to bed on a full stomach, your digestive processes are going, and guess what? You're not going to sleep as deeply
Mhm.
because your body is having to go through the stress. And yes, digestive processes are an additional stress on the body, while the body is then also trying to go into repair mode, while the body is still trying to process the stressors of the
Yes.
day. It's too much. So your bedtime routine actually starts at dinner time. And Dr. Dietrich, I think the next time we come on, I'm going to talk about the importance of proper nutrition as an immune system booster and how people can go about that as well. So
Excellent.
now you're going to get ready for bed. And when you get ready for bed, I'm going to ask you to rinse your nasal pharyngeal passages with warm salt water. Warm salt water. And there's some wonderful preparations out there on the market. Arm & Hammer has one. Neilmed, Neilmed. That was formulated by a doctor. It's ionized salt water, rinsing out your nasal passages, based from an ancient tradition from Ayurvedic medicine, or medicine that you find on the continent of India, where you rinse out your passages. Well, and you're going to gargle with warm salt water. Why are you going to do this and not a commercial preparation? Commercial preparations have alcohol in them, and that's irritating and drying to the mucosal passages, and that can lead to them thinning or being disrupted, and that's what you don't want to do. You want that protective barrier there. So you're going to gargle and rinse. You're going to rinse out your nasal passages. You're going to gargle with warm salt water. So you're going to literally offload the viruses and bacteria and the pollens that might have collected there during the day. And in the meantime, you will have run a beautiful tub full of warm water. And hopefully you will have put some Epsom salts in it. Relaxation doctor, you know what I'm
Yes.
talking
Yes.
about. And if you really, really want to treat yourself, perhaps a little aromatherapy. So you might add a few drops of lavender, or you might add a few drops of eucalyptus, whatever is pleasing to you. And perhaps
Those
at
are my
another
favorites.
time,
Yes.
yes, we can talk a little bit more about using aromatherapy to deepen relaxation. You're going to slip into that warm bath with the Epsom salts, and guess what? The skin is the largest organ in the body. And just like we were washing the skin that covers our hands, we want to rinse off everything that's covered our body, right? So sometimes what I like to do is I really actually like to take a quick shower, wash my hair, and then rinse everything off, and then get in that warm therapeutic bath and really let those Epsom salts soak into my muscles. And why does that work? It works because of the magnesium. That's the primary ingredient in Epsom salts, and you really feel the tension just easing out of your muscles and your body. Now you're gonna you're gonna get out of the tub and you're gonna dry off. And oh man, slip into those nice clean pajamas. And hi, Dr. Khadijah is back with us. And now you are ready to slip into your wonderful bed. You've begun to unwind. You're clean. You're rinsed. You've protected the largest organ in your body. So again, from the hand washing right into the bedtime routine, the rinsing of the nasal passages and the throat passages, you're really ready for a good night's sleep and to do that deep restorative work that happens in sleep. And another talk, I'll talk about the brain waves and all that goes on. But right now, I wanted you to really begin to establish a bedtime routine. And I'm going to add one more thing to the bedtime routine, and then I'm going to go over it again. And this is my bedtime routine for adults. This is my bedtime routine for myself. And Dr. Khadijah and Dr. Deidre can tell you Dr. Carol likes to go to bed early. I seriously about my 10 o'clock bedtime. And a nice cup of chamomile tea. That just tops it off. It's something that very naturally and holistically deepens relaxation and just prepares the mind and the body to let go of the day. And for goodness sakes, your television is off, you're not on your iPad, you're not on your iPhone, you're not checking emails and messages. The blue lights from those screens will keep you awake. The exception might be some of the Kindles have soft light on them that is not the blue light that will cause your brain to wake up and stimulate wakefulness and actually disrupt your sleep even if you go to sleep. That might be the exception, because for some of us, doing a little bit of reading before we go to bed, not in the bed, but like to sit next to the bed, and then get in the bed, can be very, very, very relaxing. So we want sleep. And how much sleep do we want? Well, again, the science is out on that, but I'm going to refer everyone to a wonderful website. I'll see if we could see it. Sleepfoundation.org. Sleepfoundation.org. Go there. There's all kinds of information. The scientific research is there. Sleepfoundation.org. And this, as a matter of fact, March 8th through 14th was actually Sleep Awareness Week. Here's something that I like, how meditation can treat insomnia. So again, the importance. And I'm just going to flip to chapter 6 in my book, Meditation in a Time of Madness, because I have a whole chapter on sleep. And this is something that you can get into as a family. So the guide on how much sleep you generally should be getting. So Western medicine, our wisdom, our science says older adults 65 and over, 5 to 9 hours. Most adults 26 to 64 years old, 6 to 10 hours. Young adults 8 to 25 years old, 6 to 11 hours. Teenagers 14 years old, 7 to 11 hours. School age 6 to 13 years old, 7 to 12 hours. Preschool 3 to 5 years old, 8 to 14 hours. Toddlers 1 to 2 years old, 9 to 16 hours. infants 4 to 11 months, 10 to 18 hours, newborns age 0 to 3 months, 11 to 19 hours. So there you have it for all the ages, from the littles to the 65 and over. So very important that we have good sleep hygiene, and that's no electronics in the bedroom. No, and that includes the iPhones, the iPads, all those things. We're not checking email. We've prepared ourselves for bed. You want to really turn off these electronics at least 1 hour before your bedtime, with the exception of a Kindle that has an adaptive soft light setting in it, because reading can be a part of the bedtime routine. And you want to establish this bedtime ritual. So this allows your brain and your body to begin to relax, and each part of the ritual is the signal. So from the dinner time, where you're slowly down regulating your activities, to going into your bathroom, running your bath, and while you're running your bath, you're rinsing your nasal passages and your throat passages. You're slipping into your Epsom salt bath with those magnesium salts in there. Maybe you've added a little bit of aromatherapy. Maybe you've even lit some candles. You're really doing it now. And you're going to just begin to literally unwind, relaxing all the muscles in the body, sending signals of safety and wellness and abundance to the body and the mind before you go into sleep, right? And then when you get out, you dry off, you put on your pajamas or whatever your sleepwear is. You want to slip into your bed. You want the room to be both cool and dark. And maybe you want to sip on a little bit of chamomile tea. Egyptian chamomile is my favorite. And then you're ready to turn out the light and restore, reboot, rejuvenate, and renew. And that's called sleep. And that's called boosting your immune system night after night after night after night after night. And that's the reset that I'm recommending.
Excellent, excellent. So I'm glad that everyone was able to give their expertise about prevention in this age of Corona. Okay, starting off with testing, what to expect with testing, social distancing, also proper hand washing, use when it's appropriate or not appropriate to use hand sanitizers, as well as one of the ways you can help boost your immune system, which is very important, in the form of getting enough sleep, practicing adequate sleep hygiene. Okay. And so we can go ahead and take ourselves out. And please know that we're going to be back doing more live streams about not only Corona, but other very important topics. Of course, our perspective in primary care from two board certified family medicine physicians, as well as an emergency physician. And so we're just here to educate you all, to help you all improve the quality of your lives, to be more healthy, more helpful to yourself as well as others. And having said that, if you find this live stream informative and important and useful, please, please, please share it. Share it with those who can definitely benefit, as well as if you're coming in a little bit late, go ahead and start from the beginning and watch it, and just be kind enough to hit replay so we can see that you started from the beginning, and just enjoy this information that we're here to share, because we're glad to do it. Okay, that's what we're here for. We're here to help educate and inform. Okay, so I'll go ahead and start the closeout. I am Dr. Dietrich L. Gorman. I am a board certified family practice physician. I am a best-selling author of my book, Relaxed and Ready, A Simple Roadmap to Reducing Workplace Stress and Frustration. I'm also known as America's Relaxation Doctor. I help individuals who are stressed at work learn to relax and refocus in order to have a more healthy, productive, and fulfilled life. And so just going back to my book, some of us, in this day and age aren't able to be at home and be isolated. We're on the front lines. We're healthcare providers, doctors, MPs, pharmacists, dentists, even people who work in like in the grocery store, postal service people, we still have to be there, and we're definitely putting ourselves at risk. And putting ourselves at risk can cause some stress, right? So I encourage you to pick up a copy of my book and find out ways how you can actually decrease your stress in the work setting. Okay?
Yes, it's an
Yes.
excellent book.
Yes.
Anybody who works needs a copy of your
Yes,
book.
thank you. Dr. Khadisha?
And I'm Dr. Khadisha. I'm your board certified emergency medicine physician. Thank you for watching tonight. Also, the author of the best-selling book, Help Us Help You in the Emergency Room. It's what an ER doctor would tell you if she only had the time. And given these times of the influx of people coming into the ER with concerns of having COVID-19 or just from flu and strep, whatever ailment, this book will help you mentally and physically prepare for an ER visit by navigating it more efficiently and avoiding the things that can cause delays in care. So you can get that at www.helpushelpyoubook.com. And I help people with my emergency care and advice, concierge care and advice, people be better prepared for emergency medical situations by being feeling better, being safer, and just being more prepared for the ER.
Excellent.
Carol.
Yes,
Take us
and
out.
yours truly. So take us out, Dr. Carol Penn, doubly board certified in family and obesity medicine, and a master movement meditation and mindset coach. Also, author of the best-selling book. And I have my little buddy right here, Meditation in a Time of Madness, a guidebook for talented tweens, teens, their parents, and guardians who need to thrive. This book is filled with tips and advice for kids and parents, kids and teachers, things that we could do together, particularly while we are spending more time together and sheltering in place, and some of us are in quarantine, and we need to have activities that we could do together and not just be, further isolation and, on the phones or the tablets all the time. We need to know how to talk to each other and communicate with each other. I've got some special products for you over on my website, www.medimovement.org. That's MEDIMOVEMENT.org. Come on over there, visit me, check out what all of us have to offer, because we are here to serve you. We're here to support you. And I am looking forward, my dear, dear, dear colleagues, Dr. Dietrich and Dr. Khadisha, to having another Perspectives and Primary Care with the both of you.
Aw. Till next time. Okay, bye.